Hello. I want to welcome everybody back from break. Thank you again to Judge Hawker for being here this morning. It's always kind of nerve-wracking to be the first one, but he took it like a champ, so I appreciate that. We have our panel here this morning. We have a different group, all different ages, all different sectors of the community. And so I'm going to introduce each one. And then Amanda here is going to help moderate. Please have any questions that you're willing to ask. Don't be shy. We'll be around in the audience. And I'm afraid to say anything goes, but basically anything goes. So, yes. So we have Judge Tom Brummett. He presides as judge of Lubbock County Court at Law Number 2, a court of general jurisdiction, and has since January 3rd of 2023. His court hears misdemeanor criminal cases, family law, and small amounts of probate, guardianship, and civil cases. He graduated from Texas Tech University in '96 and Indiana University School of Law in 2002. Prior to taking the bench, he served as Lubbock County Assistant District Attorney for 20 years, specializing in traffic and intoxication offenses. He has been involved with the Lubbock County DWI Specialty Court since its inception in 2007. Next, we have Mercedes Martinez. Mercedes is a proud Lubbock native and an animal lover. She discovered her passion for substance use through her major in applied rehabilitation psychology. She interned at Family Counseling Services, contributing to substance use groups. In 2013, she joined the Managed Care Center for Addiction and Recovery, mentoring women at Walker House. After transitioning to crisis intervention, she helped families in unsafe situations. Now with the City of Lubbock Public Health Department, Substance Use Service Assistance Network, she enjoys supporting individuals of all ages in our community. Amber Lee is next. Amber is a committed member of Al-Anon and ACA and has been facilitating STEP meetings at the Recovery Center at Texas Tech University for the past 2 years. Her journey growing up in a home with addiction has fueled her dedication to the recovery community. Currently, she is a nurse in graduate school at Texas Tech Health Science Center, pursuing a degree as a nurse practitioner of psychiatric mental health. Her active involvement in Lubbock, Texas recovery community, regular attendance at ACA, Al-Anon, and open recovery meetings testify to her commitment and supportive network. Next, we have Caitlin Hull. Caitlin is a member of the Youth Coalition TAG, Teen Awareness Group, here in Lubbock. She is currently a high school senior at a private school and plans to attend college next year, majoring in pre-med. Through TAG, she gets a chance to be a voice over substance use prevention and mental health awareness. She is a founding member of TAG and has happily participated in the group since 2023. She enjoys being part of TAG and being surrounded by a group of youth who strive to make a difference in our community. Carolina Hernandez Acosta is next. Carolina is a senior at Lubbock High. She enjoys running on the cross-country team and track team. Her hobbies include piano, art, and volunteering for the Lubbock community. She is also a member of TAG, the Teen Awareness Group. Madeline Gieslin is next. Madeline serves as the Health Promotion Manager at Lubbock Public Health, where she's worked since 2016. She received her bachelor's degree from Baylor University and her Master of Public Health from Boston University School of Public Health. Her primary interests are centered on HIV and STI prevention and health equity. Her work laid the foundation for the LBK Community Network, which seeks to improve health outcomes for our community. She is also involved with the Lubbock Public Health Intermediary Care Clinic. Finally, we have Bobby Carter. Bobby is a licensed professional counselor in Texas with over 20 years of experience in the helping profession. He earned his bachelor's in psychology from Lubbock Christian University and a master's in counselor education from Texas Tech University. Bobby began his career at the Children's Home of Lubbock, aiding children affected by trauma. Currently, as the Director of Diversion Services at StarCare, he leads initiatives to provide crisis support and mental health services, aiming to divert individuals from emergency departments and jails. Please welcome our panel.
Okay, so this is the fun part. This is where you get to ask questions. The panel will answer them. Feel free to ask anything that you want. But first, we want to just go down the line and let each panelist kind of tell us again who they are, who they're with, and how their work involves our substance abuse in the community.
Morning. As was introduced, my name is Tom Brummett, Judge of County Court at Law Number 2. Prior to that, was a prosecutor here in the Lubbock County DA's office for 20 years and was a founding member of our DWI court program. For those of you that are not familiar, our DWI court program is one of 2 specialty court programs in Lubbock County. The other one is our drug court program that's presided over by Judge Billy Eichmann. What this is a post-adjudication specialty treatment court. What that is we have folks that are coming in that basically are saying, hey, I've got an alcohol addiction issue. I cannot deal with that on my own. And we have a specialty court to give them every single tool that we have under the purview of community supervision to address those substance abuse issues, a little bit approach outside of your normal criminal jurisprudence tactics, at the same time keeping the community safe.
Hi, everyone. My name is Mercedes Martinez. I am with the Susan program here at the Health Department. Well, not here, but with the Health Department. What that stands for is Substance Use Service Assistance Network. What we do is we help Region 1 with substance use treatment or attaining treatment. We can help them with housing and hygiene items. We help with Narcan, we help with getting them into treatment, transportation, things like that. We also have our family side that we also provide groups for the community. We have women's empowerment, youth empowerment, and one of our community health workers is actually starting a men's empowerment, which I think is pretty amazing. Aside from that, we are in Region 1, like I said. We offer lots of services, so more than what I'm listing now, but I wanna go ahead and pass this on.
Good morning, everyone. My name is Amber Lee, and I am a member of Al-Anon and ACA. What they are family support meetings. We're friends and family of alcoholics and also adult children of alcoholics. And we are recovery meetings where people can come every week and share their experience, strength, and hope. Alcoholism and addiction is a family disease, and we help give people coping skills to help deal with that at home. Thank you.
Hi, I'm Caitlin Hull, and I'm currently a senior. I'm part of TAG, which is a youth coalition for substance use prevention and mental health awareness. And we are currently working on Project Sticker Shock, which is advising adults to not share alcohol with minors.
Good morning, my name is Carolina. I'm a senior at Lubbock High School. And ever since I took IB psychology, I got really interested in real world applications. And so joining TAG and working through passion projects has also introduced me to this important work in mental health and wellness. And I just know that it's something I would like to pursue as a career, whether that be research in advancing medication or treatment, or even just counseling outpatient or inpatient, whatever it may be. I enjoy advocacy, and I am really glad to be here. Thank you.
I'm Madeline Kiesland. I oversee the HIV outreach program at Lubbock Public Health, as well as our public health follow-up programs. I also oversee the LBK community and work closely with the intermediary care clinic. All of these tangentially touch substance use disorder in that frequently clients who come in at risk for HIV or STIs also have co-occurring substance use disorders. And the work of the LBK Community Network focuses on improving health outcomes by addressing social determinants of health, which is also one of the primary aims of the intermediary care clinic. It's to get people, get their social needs addressed so that we can improve their physical and mental health needs.
Hello, my name is Bobby Carter. I'm the Director of Diversion Programs at Star Care Specialty Health System. It's the local mental health authority here in Lubbock. As part of our diversion services, our main focus is to reach folks in the community within our 5-county catchment area who are in a mental health crisis in order to divert them from emergency departments and jails in order to get them to the appropriate place to get the help that they need and the resources that they need.
Great, thank you. So now if y'all would raise your hand if you have a question. If you can't speak loud, I'll try to come to you to bring the microphone to you. So does anybody have any questions? I'll get us started. Bobby, this one's for you because you have the best shoes on the panel.
Thank you.
What made you decide to go into the work that you do?
Oh, man. Well, I guess, majority of folks who get into mental health typically have some type of history in it. So with my history, I grew up in a household with a very abusive father. And because of that, it caused me to have to get counseling myself at a very, very young age. And I remember it was in Amarillo, Texas. His name was Dr. Hammer. And I remember he helped me immensely. And decided then, I told my mom, I was like, you know what, I think I'm going to be a counselor when I grow up. And so I became a counselor. I primarily started wanting to primarily work with kids, but then I was able to get a position at Star Care working on the Assertive Community Treatment Team, which is providing outpatient case management and psychosocial rehab services to the most significantly mentally ill in the population. That's folks with schizophrenia, schizoaffective disorder, bipolar disorder, and just really, really enjoyed that. My main focus was to provide services to them to keep them out of psychiatric inpatient units, and really, really fell in love with that. And then I transitioned to Mobile Crisis Outreach Team and have been in the realm of mobile crisis outreach and forensic services and diversion services since. So I've been at Star Care going on 16 years now. So,
Thank you.
So I have a question for the young lady that's a part of TAG. Can you just kind of share some more information about what the program involves and how you get other teams engaged?
Okay, so for TAG, so far, one project that we're working on is called the Sticker Shock. We designed stickers that have statements that encourage consumers not to distribute alcohol to underage minors. And the process to receive permission from businesses like supermarkets and such has been really insightful because we speak with managers and we present what we want to do, but there are certain barriers and obstacles. So we, over time, reached corporate, and we weren't able just yet to continue this project, but we are exploring other avenues such as like coasters or distributing napkins and such. Caitlin, do you want to add anything?
We have also attended outreach events like with the Hub City and with other, like the Catholic Charities of Lubbock. We were on Trends and Friends to promote the stickers, and we are currently working on getting those out, like she said, with coasters and other things. When we went to present to United, they had to go through the actual owner of the alcoholic beverages, so United themselves couldn't distribute the stickers. So that was one thing that we had to get through, but they did make suggestions like little posters that we could attach to the shelves, so that was a good idea.
All right, do we have any other questions? Way over there. All right.
So Smart Recovery is different than Al-Anon and ACA. We talked about it today. Dr. Buddy Gerber is speaking about starting a meeting at the Recovery Center at Texas Tech. So we'll have to get with you afterwards, but I'm with ACA and Al-Anon today. I'm sorry, you're welcome.
All right, who's next?
Amanda, there's someone back there.
I see that.
I've got one here in the interim.
My question is a general one. sometimes when people are caught up in families with addiction problems, which can lead to legal problems too, it's difficult to find the place to go because there are so many agencies and help available, but people don't know where it is. What is the best way to advise someone to go to a clearinghouse? Should it go to the public, to the, I wrote down some of the things here, but could you give me the examples of the place to send people whenever they need to get help and they just don't know where to go?
Yeah, I can field that one. So if we're speaking specifically about families affected by substance use disorder, the Susan program at Lubbock Public Health is a really great resource because they can help people who are experiencing substance use disorders, but also those who are at risk of substance use disorder. And so their focus, and Mercedes can speak to this a little bit more too, but their focus is really on intervening and supporting families and individuals who are needing services and intervening to help keep people from falling through the cracks, so they can help with paperwork and obtaining documents and housing. But if they're looking for other resources in the community, I'll make a plug for the LBK Community Network through Lubbock Public Health as well, where we've created a network of agencies who work collaboratively to help address social needs and to sort of reduce the time it takes to get connected to services, and also to take a lot of the burden off of the individual seeking those services. So if it's not specific to substance use, LBK Community Network is a great resource. If it is specific to individuals experiencing substance use disorder or at risk of substance use disorder, our Susan team is awesome for that.
And yes, thank you, Madeline. So building off of what Madeline said, we have a great team on the Susan side. They actually go out and do lots of outreaches where they will just get into a car and go drive down the streets of Lubbock and just talk to people that they come across. So with that being said, even if it's not substance use related, maybe they just have a need for food and they have no substance use, we still provide resources and referrals. So we can still refer them out to Catholic Charities, other agencies, Lubbock Impact, so things of that nature. We work with the food bank, and it's really just, we talk to them, we let them know that what we offer, and if it's something that we don't offer, we point them in the right direction, and we definitely provide them with a warm handoff.
Hi, my name is Audra Nivens. I'm a senior at Texas Tech University. I'm undergrad student in social work. This can be for anyone. I just was wondering, what would be your biggest piece of advice when pursuing a profession where you are pouring into people constantly and helping others?
You think I'll be good enough to answer that? Okay. As a therapist, I think it depends on what area you want to go into. You know, I mean, if you're looking at going into like the clinical social work realm, licensed clinical social worker, and maybe try to do like private practice and things like that. One thing that I remember going through my master's program is they really didn't focus a lot on the diagnosing of mental health disorders and things like that. You know, there was a really big focus on like the different counseling theories, techniques, all that other stuff, but they didn't really have anything that focused on the diagnosing of a mental health disorder. So if you go into private practice and you want to see someone for, you know, general anxiety or depression or whatever, you have to be able to recognize what symptoms they're presenting with and give them a diagnostic code in order to be able to bill for like an insurance or anything like that. And if you don't know how to diagnose a mental health condition, then you're going to be in trouble. So that's one thing. And then, of course, there's the whole outpatient, inpatient realm too. You know, inpatient has a lot more perks for some people as opposed to outpatient. Inpatient, you're probably, if you're going to do like inpatient substance abuse treatment or inpatient psychiatric treatment, you're going to see a lot more acute folks, a lot of people that are really kind of coming in at their worst. I find some social workers and counselors that find that very, very rewarding because they see someone coming in at their worst and they're able to help them progress through their treatment and get to the point to where they're ready for discharge and they're ready to go back out in the community. And then some people prefer the outpatient realm, which means they go out and meet people where they're at. You meet people, you know, whether it be on the streets or whether it be in their homes. So I really just think it depends on finding what you want to do and what you feel comfortable with. Did that answer your question? Okay, good, because I was volunteered for that one. So I'm glad I answered it effectively.
Oh, I do want to go and say that in my billions of years of schooling, I had a professor when I was at South Plains, how I initially found this field. She said that social work is not a field where you're going to be rich. You're not going to make tons of money. You have to know going in that it's going to have to do a lot of the richness with the people you help, and it's going to make your heart full of love in that aspect. Now, she did say that if you want to get rich, it's definitely not that field. So just keep that in mind too, because we get paid with lots of gratitude, even those who aren't grateful for us. So that definitely, it doesn't fill our bank, but it fills our hearts. So I just wanted to let you know that.
Hi, these questions is for the two high school students. I think it's great that we see some younger faces here. It's a great representation. I kind of have two questions. The first one is, what are just some helpful, impactful prevention resources that you or your friends are hearing about in high school, and what do you think works best? Also, what about just prevention or having more resources with vape shops, local smoke shops that are selling synthetic marijuana that is producing long-term mental health issues?
Hi. So I know that there are a lot of resources at my high school, for example, but sometimes they can be either just not easily known, maybe. First of all, I think that more conversations should be held in classrooms sometimes or by adults and parents. I think that sometimes there's like a miscommunication between just adults and children and that, or adolescents, and that education on consequences and such is just not very vast.
I know at my high school we do have a guidance counselor, but not many people go to that person. So I feel like people at my school definitely need the resources provided to them, like through a list. So that could be helpful. And we have looked into providing stickers for vape shops and other shops like that. We just haven't gotten that far yet.
And to add on to that, at Lubbock High School, just like literally a few blocks away is a smoke shop, vape shop, etc. And it's so bright when I'm driving past it. But I think that unfortunately, as just minors and not much power through like maybe, dare I say something that's political, I think that it's difficult to remove a building like that or such. And so what we're doing is just trying to basically like go around those obstacles like stickers, and just maybe it catches attention of people. Hopefully it would, and that's where we're starting. But of course, down the line, in the future, that's something we'd want to go further into. But yes.
I'm going to ask the next question real quick. So I think this goes back to a couple of questions ago. When people are in crisis, they don't always know the name of Susan or the Lubbock networking group. If they call 411, are they going to be directed to you? Or if they call a crisis hotline, where are they going to get directed? And is it going to get them to the resources they need?
For anyone that finds themselves in a crisis, there are several options they can utilize. They can use our 24/7 crisis line number, 806-740-1414. That'll get them in direct contact with a contract provider that StarCare utilizes called Avail Solutions. They will screen the call if they feel like that it meets the necessity for a crisis assessment. They will contact our mobile crisis outreach team and we will respond in the community, or they can come to Sunrise Canyon as a walk-in. At our Sunrise Canyon complex, we have on-site 24/7 crisis services. We have MCOT workers, qualified mental health professionals on site to be able to provide crisis assessment and screenings. 911 is also an option. We have a memorandum of understanding with emergency medical services that if someone calls 911, they respond in the community and it's a mental health issue, and they don't need any type of physical health treatment, they will bring them straight out to us rather than take them to an emergency room. We average about 325 of those drop-offs a year. There's also 988, which is a national suicide number that people can text and call. If you go through that number and it's determined that you might need someone to make contact with you, 988 will then refer that to our Avail Solutions contractor, and the Avail Solutions contractor will dispatch our mobile crisis outreach team to the person's location. I'm sorry? Well, it depends on the situation. If we do an assessment and it turns out that the person is just in need of substance abuse treatment, then we will refer them to our OSAR department, which is Outpatient Substance Abuse Screening and Referrals. They will conduct a substance abuse screening, and then they will provide the appropriate referrals to community agencies in order to assist with that. If it's something if it's something more serious, like there's a co-occurring thing going on, such as suicidal ideations, psychosis, and things like that, we have a 23-hour extended observation unit that we can admit to, and we also have a 30-bed psychiatric inpatient unit on site at Sunrise Canyon.
I have a question for the two high school girls. What age did y'all get involved with this, and how did y'all even hear about it or learn about it at school?
So I started the beginning of 2023, so I'm currently 17, so I guess 16. My mom actually works for the city. She's standing in the back. And so she knows Lynette and Macy, and that's how I got involved in TAG.
I would say, earlier I said this, I think, that when I took psychology just last year, it really opened the doors to understanding things that I've just experienced throughout my life in childhood, and just understanding my family members and certain things I've observed, but also just interacting with strangers and maybe personal things as well relating to that. And joining TAG, I can't remember now how I joined, but I know that I was interested in like medicine, and since there's so many like blocks to sometimes shadowing because of underage and such, I was referred somehow to TAG. And from there, attending the meetings has been really insightful, just having discussions that aren't really cultivated sometimes in school. And personally at home, for me, yes, but it is also good just to hear from other people and make connections as well.
I have a question for Judge Brummett. So can you explain how someone enters into the treatment court, because you said it's post-adjudication. How does someone enter into that treatment court, and then what are those services, what do those look like once they're in the program? And then I have a follow-up for Mercedes.
Okay. So naturally, they have to be involved in the criminal justice program to begin with. So they either have pending charges or they have pleaded guilty to an offense and they are facing a revocation, or that means that the state has alleged that they have violated some of the terms and conditions of their, what we used to call probation, now we call community supervision, and they find themselves at penal risk. And so that can come in through a referral from their attorney to say, hey, I've got somebody here that I believe fits the profile, being high risk, high needs for substance abuse in general, for our court, for alcohol abuse disorder specifically. A lot of those referrals come from their defense counsel. Those can also come from the state, from the member of the district attorney's office, the ADA that's prosecuting the case, can say, hey, I think they fit this profile, and can refer those. It can also come through our community supervision department. If they are supervising somebody and they say, hey, these folks are on, quote, regular probation, and I'm seeing positive UAs, I'm having lots of signs of substance abuse issues, I think other than just simply filing a revocation and having them adjudicated and then possibly sentenced, I think that they would be more of a fit for the program. So there's several pathways to come in. There is kind of a misnomer out there that you have to be charged or your underlying offense has to be an alcohol-related offense. That's not necessarily true. We have people in the program that are there for different types of offenses, but they all have that alcohol high risk, high needs evaluation where we've deemed that they would be acceptable to the program. What was your follow-up question?
Once they're in the program, what do those services look like for that client?
Well, and you know, Ms. Ford knows because she knows what I'm probably going to say. She's heard me say it before. Both Judge Eichmann and myself are ambassadors for our programs. We go out into the community to the degree the law allows us to and talk to different civic groups. And one of the things I commonly say is, listen, this is not, you know, what are the derogatory terms I've heard in the past? Hug a thug or happy clappy court, things where you just tell people, yeah, I'm sorry you're struggling with your program. Here's a gift card to United, go about your way. It's not that kind of a program. I'm not an alcoholic, and I don't know if I could make it through this program. It is rough. When they first come into the program, and we have a four-phase stepped approach where at different phases they have different responsibilities and things that they have to do. When they first come into the program, they've got to meet every Thursday. So every Thursday, they've got to come to my courtroom and meet with everybody else on the schedule and have a court session. They have between 3 and 5 AAs a week. Every time they turn around, they are on what we call a random UA call-in line, which means probably, I would say, anywhere from 3 to 5 to, depending on what's going on, 6 times a week, they have to call a phone number that morning. And the morning says, yeah, you got to come down, you got to pee in a cup. And we're going to test that for any alcohol or other substances. And part of our testing protocol is, I think those of you are familiar with ETG, ethyltheroglucuronide, which is the metabolite that generally goes out 72 hours. They have to do that. We have group counseling. We have individual counseling. They have to go, like I said, through AA, get a sponsor, be through a 12-step program. Those can move at one time. They go through our community supervision department's program called Thinking for a Change, which is a lengthy program. And I mean, that's what I'm saying. By the time that these people get through phase 4, they have demonstrated not only have they been able to get past that, what I call kind of that white knuckle, where you just come in and somebody says, hey, okay, don't use for 6 weeks and you'll be good. And a lot of them are going to start that. And I don't labor under any misperceptions that I have people just lined up the door saying, yes, I want to come and have you running me around ragged every time I wake up. Honestly, these people are coming in because a lot of them are facing serious time in the Texas penitentiary, either on a revocation or on a new charge. And when they come first into this program, it is because it is the easier path. It is the path of less resistance. But that only lasts so long. The quickest you can mathematically get through our program is 18 months. I don't think we've had anybody go through 18 months. The fastest is about 20. So eventually they come in, they're white knuckling, and then that's going to start to break down. And it's funny, we have what's called an interview process before we have graduation. We're going to have a graduation tomorrow. So if you have nothing else to do and you're at the courthouse, come by at 12:45. You'll get to see the end result of this program. And we have an interview process with them where we will ask, what's that period? Because I know they come in and they're like, yeah, this is better than the pen. Fine, I'll go to the things. I'll pee in the cup. I'll do all the stuff I'm supposed to. And then after a while, when they've got enough sobriety under their belt, you can see that light kind of come on. And there's this, I haven't yet to come up with coin a term for it. There's this corner that they turn where they start to buy into the program and they start to realize the benefits. And then it becomes something that I got to do and that I have to do so I can stay out of jail, into something that benefits my life and that I want to do. And as a judge, it's great to see that switch when it happens. But sometimes we got some knuckleheads and it takes longer to deal with. You can bring that horse to the edge of the water. You can put a salt tablet under that horse's tongue. But you can't always get them to drink the water. But I can tell you from our reviews that we've done, our recidivism rate, or the rate at which people find themselves involved again in the criminal justice system, is about 3 times better than when they don't have this program or through regular community supervision. Lawyers talk a lot without always answering the question, but you get to talk to a lawyer for free, so that's a good benefit.
Thank you, Judge Frummett. I have a follow-up for Mercedes real quick. I apologize. So with the Susan program, do y'all offer MAT, so medication assistance treatment, like we can refer a client, like in DWI court, for medication to help them stop drinking? Do you provide any of those services?
So we do offer assistance with medication. However, I don't believe that's one we do. And we do have an ICC clinic that can possibly help with that if Madeline wants to help and touch base on that one.
Oh boy, I was not prepared for that question. Jesus, I'm going to put you on the spot. I know we can help with buprenorphine. I believe we can help get people connected to that. I don't know about MAT. What do you know? That's a new, good. I'm not just like ill prepared. That is not something that we have had to address yet because our ICC clinic is still very new and very much in its infancy and in the pilot period. So every day is a new question. We will take that back and figure out what that would look like to help with MAT.
Madeline, can I jump in real fast too? I know that conversations have been made and we have had some very early planning of what that might look like. Like Madeline said, though, ICC is in a very beginning stages, so we need to make sure that it's up and running and secure before we add things to it. But Matt definitely is on the forefront, hopefully.
Okay, this is for the two young ladies. So is this an after program deal or in school program? And what are the ages of kids in the program? And how often do y'all meet to make these plans?
So it's an after-school program, not through the school, with the public health department, I believe. And we meet usually once every month, like from like 6 to 7, anything.
We have mostly high school kids, but I think we're starting to accept junior high kids. And so basically, if you find Lynette or Macy, we can get an email and sign you up if you know anybody.
Hi, I wanted to, I wanted to ask if there was any, for any of you up there, if there is any support or resources for individuals who are trying to maintain long-term recovery and what that would look like.
So for long-term recovery, we do partner with Synacor and Grace Manor. So when it comes to long-term, we look towards them to help us, and then we do provide assistance for sober living. So we oftentimes will help with rent and things like that, and if they need more assistance after we help them in that situation, then we just continue to case manage them and provide resources and further referrals, whatever that they may need at that time.
I have a question while I'm walking over there. What role does collaboration play in each of y'all's jobs and expertise?
So I will go ahead and say, I didn't want to jump the gun on anyone, but for us, it plays a huge role. I think it's imperative to have a running list of our resources and our referrals. And then I think it's important to not only attain new relationships, but constantly nurture them and foster them. So we are definitely always trying to create relationships in the community. And of course, you know, I just spoke and met with Danny. I don't know if he's here in the audience, but he happened to tell me that I was the first friendly face that he came across. And I take that as a compliment because that's just my general life stance, is to always try to, there he is back there. I'm always trying to talk to everyone who I can talk to. So I think it's imperative in our field of work.
For TAG, collaboration is particularly important between our adult supervisors, Lynette and Macy, and then us adolescents, the teenagers and middle schoolers. The adults are a little more knowledgeable, especially since they're from the public health department, and can help us through what we're seeing and are exposed to in that launch projects and things that we want to try to address it or raise awareness for.
As I mentioned earlier, for the staff that I oversee, the programs that I oversee, none of us are experts in substance use disorders, but the work that we do touches on it, so it's imperative for us to collaborate with those providers and to recognize some of the situations where those needs might exist. So my staff works closely with like the county jail and with the Susan programs, and also with some of the treatment facilities to provide services, because we know that if we can get people treated for their sexually transmitted infections or get them on HIV medications or on PrEP to prevent HIV, we are reducing their risk and helping them be proud of who they are and helping them support themselves. And then when we cannot help, or when we can at least meet this one need, then they have capacity to try to meet some of their other needs. And so since we are not the experts, we refer them to the people who are. And the nice thing about having the Susan program in-house is that we can frequently just call, an extension and get them connected to those services as well.
StarCare's community collaborations are very, very important in order to reach the people that we need to reach. We have a strong community collaboration with Lubbock Police Department. We have a strong collaboration with Hockley County Sheriff's Office and Levelland Police Department. Hockley County and Lubbock County are two of the counties we serve that have our highest call volume. We have a co-responder model that we utilize with Lubbock Police Department. We have a qualified mental health professional riding along with a licensed mental health peace officer responding to mental health calls that go through police dispatch. We also have that with Hockley County Sheriff's Department and Levelland Police Department. We have a strong collaboration with Lubbock County Detention Center. We have a full array of services out there, from mental health screenings to mental health case management to medication stabilization. That program started several years ago. It started out where we had a staff of 2. Now we have a staff of like 23 out there. So we have a very strong collaboration with them. We also have a strong collaboration with Judge Hawker's court. He handles the court with our competency restoration folks in regards to those being seen for outpatient competency restoration and jail-based competency restoration. We do have the ability to provide competency restoration for those that are in jail to keep them off the state hospital wait list for restoration. And then, of course, we have a very, very good collaboration with Covenant Medical Group and University Medical Center to accept referrals from their emergency departments for those in mental health crisis. And we also assist with completing mental health assessments at Covenant Children's ER and their adult ER as well.
So ACA and Al-Anon, we collaborate with the Texas Tech Recovery Center and also AA and other 12-step meetings here in the city. Al-Anon sponsors, Al-Anon just got an Alateen. Hello? An Alateen meeting started, and it meets Monday at 6 p.m. at the Recovery Center at Texas Tech University.
Hi, I worked at Grace Manor, and I was just wondering, we're 18 and above, and if I get calls for younger than 18, and if you could just suggest some resources to help that population.
I will go ahead and take that one. So we work with Daily Recovery. We have, yep, right over there, there's Miss Latasha. So they are outpatient, and Miss Tasha's here, and she can definitely touch base on that. But Daily Recovery in town would be one of the first ones that I would recommend.
And my name is Amber, and we have an alternative peer group. It's for LISD students. Daily Recovery comes also, and it is Thursdays and Fridays from 6 to 8 at OL Slayton. So that's also a resource. And then there is also the Alateen meeting, and that is at 6 p.m. at the Recovery Center on Mondays. Did you have a question, Kendall?
My question is for the lady next to the
Me. Okay.
With the PrEP services that you're putting involved in, who funds that long term?
Who's funding our PrEP services long term? We are using the 340B waivers to help cover that cost and get reimbursed for that. And then there's also the 1115 waiver, I believe, that we're using. So we are using the resources that are available, and it is self-sufficient and actually is helping us increase the revenue. So we've been able to make that self-sufficient without relying on grant funding or it's not a pool of money that is provided. It's 340B primarily. Okay, Buddy, you've been really patient.
Thank you. I've got a question for the judge because I'm a huge fan of specialty courts in general. In A1, there are a multitude of specialty courts across the state and across the country in different phases, different types. Is there a commonality in the way that they're all run, or does that differentiate from jurisdiction to jurisdiction?
Well, as far as when the rubber meets the road, some details might be different, but most of us, and when I say us, I'm talking about the specialty courts all across the country, generally follow the best standards practices and the techniques that are promulgated by the national organization. I think it was formerly the National Association of Drug Court or Specialty Court Providers. Now it's known as All Rise. They rebranded themselves for people like me that can't remember the acronym. And that is the national organization that has the money and the resources and the grants to put out the big research projects. Believe it or not, specialty courts are still a relatively new concept. And so one thing that they did this last year at our national conference, which was in Anaheim, is came out with the first revision of the best standards. So when they came out with what we called the 10 guiding principles, that was to be used uniformly among all the specialty courts in the country. Then after they had about roughly 10 years of data, then they went, because first of all they said, well, this is what we think is going to work. Now 10 years later we got the data, let's go back and evaluate and see. They tweaked a couple of things. The good news is most of those things were validated by the scientific studies later. So what I'm talking about is things that are integral to the process, such as sanctions and incentives being used together, having your population be high risk, high needs. Some programs are going to be post-adjudication, whereas I talked about Lubbock being or pre-adjudication versus post-adjudication. One of the things that universally applies to most specialty courts is the nexus between behavior that's needing the correction and whatever the action is by the specialty court. So unlike, the quote, regular criminal process, you have somebody that's on probation, community service, community supervision, and they have an allegation of a violation, motion to revoke gets filed, they get an attorney. 6 or 8 months later, if you're moving fast for courts, you may have an addressing of the issue where, plea is entered or you have a hearing, judge enters. Okay, one of the best practices in specialty courts is a close nexus between there. So our court meets every Thursday. So which means if we have behavior that needs to be addressing a violation or something that needs to be addressed by a participant, the maximum that can possibly take for the court to address is 7 days. Now, there is an issue where if they're going to be incarcerated, they do have a constitutional right to have that a hearing, and we have that in front of a different judge. That can take a little bit longer. But those standards, those practices, those rough underpinnings and scaffolding of these programs are pretty widely adhered to by all of the specialty courts. Now, a lot of states have a state coordinator. I think Texas just brand new got one that kind of coordinates and then reports back. So there's different tiers to the bureaucracy. And each of these courts, because they are individually presided over a judge, can choose their own details of how they want to interpret them and put those in line. But the thing is, why reinvent the wheel? And you got a lot of data, and you got a lot of people that have been using this on populations of different geographic implications, and geography has a little bit of an impact. Alcoholism pretty much is going to be generally along the same symptoms and resolutions that you see regardless of geographic location. But the thing is, why not lean on those people? Why not lean on the data? And it's very well done. The data is peer reviewed. It is scientifically valid and boisterous, for lack of a better word. And we found it to be a very, very beneficial relationship that we definitely lean on those people and try to put those practices in place in our particular courts, both the drug court and the DWI court.
Thank you. And second piece to that is that someone ends up in specialty court, specifically DWI court, and they've been adjudicated, or whatever the case may be, whatever the legal issue is, and they successfully complete. They're getting the benefits of that. What legal benefits do they get from going through a DWI court?
Well, legal benefits, and they probably start with the DA's office, because they do have kind of a gatekeeper function. Okay, so if somebody, either for a new case, and we'll just pick one of the most common situations, somebody with a DWI felony, which means they've got at least 2 prior adjudications. They're looking at a 3rd-degree felony in the state of Texas. 2 years to 10 years in the pen, optional fine of up to $10,000. There's your punishment range. So we have a lot of folks come in with that kind of a profile. If the DA's office says, hey, we're not going to offer community supervision, our offer is for this person to go to the pen, well, that's under their purview of separation of government. They get to make that. They're not going to really come into our program. But the 2, like I said, I was the first ADA that was part of the Lubbock DWI court program. And when I became the judge over it, I handed that off to 2 of our prosecutors, Chris Schulte and Courtney Boyd, and they're both acolytes as well. That they believe in the program. So a lot of times, unless there's just some reason why it's completely inappropriate for this person to be considered for the program, they're going to refer it to us. Okay. And so the legal benefit number 1 is you get to remain out sucking free air in the world, and you don't go to the Texas penitentiary. That's a pretty big incentive right there. Obviously, there can be things as a sentence may be a little bit reduced. Most of those are going to be 10-year underlyings. They may be a 10-year probation. They may be an 8-year probation. The benefits are, like I said, freedom. One of the big things is driver's license issues. And there's a little bit different in your population between your drug court participants and your DWI court participants. We talk about this all the time. Our DWI court participants generally have jobs, are generally what society would call have their act together a little better until you look behind the curtain. And not as obvious to have those impairments. But one of the things is a driver's license, because most times you're charged with a Chapter 49 intoxication offense in Texas. You can get your license is suspended, or it can be revoked under certain circumstances. One of the things that I can do is I can kind of shortcut that as a specialty court judge, and I can order what we call an occupational license or an emergency driver's license, an interlock device license, where they can have their license as long as they have that little device that they got to blow in all the time to get the car to start. We can shortcut that process. I can get that into their hands, and I can get that done a little bit quicker. So there's some incentives. They do have, among our team, is one individual representing the Lubbock Defense Bar. So we have, like I said, I have 2 alternating prosecutors, not on both of them at the same time. From the DA's office, I've got a defense bar representative. I've got community supervision. I've got our treatment provider, and I have our individual that does our screenings. And so they have, that person would probably not want me to refer to it as free legal representation, because there's some fine lines on what they do, but they do have somebody that can advise them without them having to shell out big bucks for an attorney on that. And the benefit eventually they'll come to is the benefits of having a sober life. But listen, by and far, the big one is I don't have to go to the Texas penitentiary. And that's what I talked to you at the beginning. I know in my heart of hearts that a lot of people are like, yeah, whatever. I'll sign the piece of paper. I'll come in and do your BS program just as long as I don't have to go to the pen. Give me 20 months for those people, and they'll turn the corner.
So my name's Terry Don. I work for the Rancho Del Tri IOP. Hats off to Susan program. We appreciate you guys. We'd love to do something with you, by the way. My question is for the judge about specialty courts. We partnered with Midland Drug Court several years ago, and they have a specific veterans drug court. I talked to Judge Farmer last year about this, and it's something that she was interested in. Are we any closer to getting a specific veterans drug court here in Lubbock?
Like everything else, when it comes to specialty courts, a lot of them are grant funded, and so the issue is money on that is what it all comes down to. I'm not going to lie. Our legislature meets every year. Personally, I think that ought to be every 5, but nobody asked me about that. That is not an official position of Lubbock County or anything like that. That is my individual political musings. When you're dealing with, I think what is our projected surplus this year is going to be about $1 billion. Every 2 years I get a little nervous about being on the chopping block. And that's why we make sure, although it's not a numbers-driven game, the reality of is we need to have deliverables that we can show the Texas legislature to show that the money's being well spent. And I think we do that. But naturally, anytime there's a bunch of folks in Austin getting together and deciding your fate, I get a little bit nervous about it. So Veterans Court's something that's been kicked around for a long time. It is based on need and it is based on money. There have been a couple of discussions earlier about different types of specialty court. There was a push, I think, 2 sessions ago, so 4 years ago, to what they have a prostitution court, where we would have very similar programs for folks that found themselves charged with that kind of an offense, primarily on the provider side, not so much on the John side, because of the situations that a lot of women involved in sex work, why they're there, and the situations that they find themselves in. And the reality is when we looked at the numbers, it wasn't justified. I'm not saying we don't have prostitution cases in Lubbock. I'm just saying there wasn't enough to justify the amount of money to set up that separate program. Veterans courts have been kind of like that for the last couple of sessions. What I can tell you is I think this year we are closer to that than we have ever been before. Number one, because of the money being there, with the projected surplus. Number two, I think it has finally become obvious and measurable that we have the need among the veteran population. Now, in each of the specialty courts, we have kind of de facto veterans courts because we have a lot of people that are veterans that have substance abuse issues, both in the drug court program and the DWI court program. We work very closely with the VA here in Lubbock, VetStar, and some of the other programs that they have. We partner with them and make sure that we can rely on their services as well. If you're a big proponent of veterans courts, and I am, I think this might be the year, if I'm going to prognosticate, say that we'll get over the finish line on that. Now, that is a prediction and not a promise. Anything can and does happen in Austin, but I'm more optimistic about it this year than I have at any time before.
We have time for one more question.
This is for Amber. Amber, if I've got a family member that comes to me, their loved one has just gone to treatment, they're either a parent, a spouse, and they have children in the family, and we want to get them some support, how do we introduce them to mutual support, and what's that process that helps them to feel comfortable about where they're going and what they can anticipate?
Well, so we do have Al-Anon meetings daily. Sometimes we have 2 or 3 a day here in Lubbock. And they would just attend an open meeting. And I would recommend just maybe listening the first few meetings. And you just hear other people's experience, strength, and hope. And the more you attend, and you meet people, you get support from the community. There's probably about 125 Al-Anon members in the city of Lubbock. And eventually, once you read the materials and you decide to do the 12 steps, you can do the 12 steps and get a sponsor. And so when things are going really bad in your life, you have someone to talk to. You can call them sometimes not in the middle of the night, but late at night, and they can help calm you down and talk you through those issues. And then for adult children of alcoholics, we have weekly meetings where we do the steps. As an adult child, you were never really allowed to feel. You were always reacting to what was going on in the family dynamic. And so you're finally able to do the steps and kind of grieve your childhood wounds so that you can be a more productive member of society and be able to live a normal life without that emotional reactivity inside of you. And then our Alateen meetings is a place for children under 18 and under, probably 11 to 18, maybe 19, where they can go and get support from their peers, and they can talk about what's going on at home, and they're not judged, and they're able to get support and kind of do some what we call venting and getting their feelings out. So every week is more manageable and their feelings are more manageable. Thank you for asking.
Great job, guys. Thank y'all so much. Let's give them a round of applause. All right, so now is the time that you can get up and stretch your legs, grab your lunch that was generously provided to us by HEB. Make sure you're back in your seat at 12:15, and we will begin the awards ceremony to recognize those who have made the difference in our community.